once again, a very warm welcome to all of our attendees, especially now that we are going into our colder months. But to start off, we just want to remind you of the invite from the Institute of Plumbing South Africa. That is the Plumbing Industry Awards happening on the 28th of July, 2022. That is at the Royal Elephant Hotel and Conference Center, which starts at 6 o'clock. Then also the reminder about preventing COVID-19. It is resurging itself out there. A lot more figures are coming out. We see it all over the world and in more parts of South Africa. I'm not too sure what's going to happen over the next few weeks or months, but what we can do is just keep ourselves constantly preventing this virus or any other virus that might be coming with the cold months as well. Just because someone's sick, it doesn't necessarily have to be COVID. If you do get those symptoms, please get yourself tested. But it could also just be the flu, the common cold that is going around. We've seen, amongst a few people that have chatted to us, they are being sick, testing negative for COVID, and still feeling those side effects of very bad fever, chills, stuffy nose. It's obviously just due to the change of weather that we are having. But in order to prevent any type of virus, we want to make sure that we constantly wash our hands. If we don't have water or soap available, we can use an alcohol-based hand sanitizer. We also don't want to touch our eyes and nose with unwashed hands and spread those diseases around. We want to adhere to social distancing. So if you are sick and you haven't been tested, then obviously you need to stay away. If you do get tested, please remember there is an incubation period. So you might get tested now, it might be a false negative. Test in a few days' time, it might be positive. So just please adhere to what the doctor requires of you or even your employer. If you are going to cough or sneeze, please cover that with a flexed elbow or a tissue. And then very importantly, and again, as we've mentioned before, this is not just for COVID. This could be for any virus that we are finding out there, to clean and disinfect frequently touched objects and surfaces. So the tools that we are handling every day, please ensure that we clean these regularly. We don't have to use alcohol-based hand sanitizer. So some nice warm water, a little bit of Jik or something like that. Please remember, if you are washing these things with hands, that Jik will dry them out. So please be careful of that. We would suggest that you use rubber gloves while cleaning or disinfecting anything, just to protect your hands and skin as well. If you are able to, please do your part and get vaccinated. Now, the last Toolbox Talk for April 2022 is the cold months. So obviously we are entering into these cold months. A lot of you have already mentioned that you enjoyed the sessions that we had last year about some of the things that happen when it is cold. We spoke about hypothermia last year, and today we are going to be looking at our feet. And so our safety thought for this week is stand up for safety. Why stand up for safety? Well, let's get into our Toolbox Talk and see exactly why. Obviously, when working during winter or cold times, the environment can involve several adverse effects, and this obviously affects our performance when we are working as well as our health. That is because if you're not feeling well, you generally do not feel like working, is it? If you have a bit of a cold, or if you're feeling a bit down, perhaps you've got a headache, perhaps your body feels a bit run down, then you're not going to be at your peak performance. And this is what every employer dreads. Nobody wants an employee that's not going to be working hard, but at the same time, no employee wants to be working when they feel bad. So that is why there are reasons for you to take sick leave. And obviously now, because COVID is a disease that is an occupational disease as well, you can claim from Coetzee because of this. So please, rather don't chance it. If you are feeling bad, go and get tested. Or if you are sick, get a doctor's note and take your sick leave. Rather get better so that you can come back to work feeling better. Because when you feel good, you then perform well. And if you're not performing well when you feel good, well then perhaps you need to take a hard look at your training and see exactly what you need to be doing in order to get yourself up to boosting your performance, as well as not just looking at how you work, but also the safe means of working to keep yourself protected. Then any worker suffering from exposure to the cold, you will experience things like thermal discomfort, increased strain on your body, decreased performance, as well as cold-related diseases and injuries. Cold can also modify or change and also aggravate the risk of common hazards, such as cold-associated injuries. Now, we're going to speak about one of those things. But here are a few things that could happen. And as we mentioned, this is just the tip of the iceberg of what actually happens out there. When we are working in cold temperatures, cold temperature as such is already a hazard. Now you are doing hazardous work in a hazardous environment, which is cold temperatures. So this can affect the way you work, your ability to work well, as well as the impact that it will have on the body, especially because you are exposing your body to cold temperatures. Now, if any of you are aware of this, when your body gets cold, it tends to go a bit numb. And because it goes numb, it means you cannot really feel all the time what could be hurting you, what could be impacting or affecting you. And one of the things we want to mention specifically today is what we call immersion foot or trench foot. And that's really what we're going to discuss today. But the other things that can include these negative effects could be things like dehydration, numbness, shivering, frostbite, as well as hypothermia. Now, last year we spoke more intensively about hypothermia and what you would experience during hypothermia and also how you could prevent it, and then how you could treat hypothermia amongst your employees. So if you want that information again, please let us know. We'll send you that Toolbox Talk with that information. But today we want to look at immersion foot or trench foot and what this actually is. Now, before we get into that, we want to please say to you that on the scale of importance when it comes to safe working procedures, as well as mitigating the risks to any hazard, we want to ensure that we follow the hierarchy of control, that is eliminating, substituting, putting in control measures to prevent risks and hazards from occurring. Our last line of defense, which is also a mandatory requirement, is the need for PPE. But PPE is not just something that we can run to the hardware store, purchase, and put on ourselves to keep ourselves protected. We must do our due diligence by doing a risk-based analysis of what type of PPE, the best fitted PPE, and the right PPE for the person. Now, it's all in the name. PPE stands for personal protective equipment. And because it's personal, each person must identify for themselves what is best suited to their bodies. And so it means that time is needed, research is needed into exactly what type of PPE is necessary for a person. We understand that many of you will just go and buy in bulk. You'll buy 20 pairs of shoes and then in different sizes, but have you tested the shoes out? Are we just buying what is the cheapest out there, or are we doing our research into maybe something that is not as expensive? It might be also a fairly cheaper product, but it's a better fit to what we are needing. So if you are wearing inappropriate clothing, you are at higher risk for things such as hypothermia. If you are wearing inappropriate clothing and you get wet, tired, dehydrated, or you're even suffering from malnutrition, you're not eating correctly, then the risk of hypothermia is greater as well if you're drinking alcohol, because alcohol makes blood vessels dilate. Dilation means it takes up more space. And what this does is it extracts heat from your body very quickly. And as soon as the heat from your body gets lost, you get colder a lot quicker. So at this point, the body then only maintains heat around vital organs, things like your brain, your heart, and your lungs, and it shuts down circulation to your extremities, your arms, your legs, your fingers, your toenails. All of this then starts getting very cold and numb. And what happens? Well, the heart rate starts slowing down, becomes intermittent and weak. The blood vessels then widen, making you lose heat a lot quicker. And eventually what happens is you feel like you need to take clothes off of you because you feel like you're actually getting too hot, but this is not the case. Hypothermia has already set in, and ultimately what happens is the loss of blood around your vital organs starts losing more and more. It gets to the heart, where the heart now is trying to protect the heart and the brain only, shutting down other vital organs until eventually the heart stops completely. Now, you might think, well, this is never going to happen to us. We don't get that cold or extreme cold weather out in South Africa. Well, we do in certain parts. There are times where it can be extremely cold, but it could also just be normal cold weather. but prolonged and inaccurate or inappropriate PPE or clothing that we are wearing during those times. Now, to add to that, as plumbers, you are working with water in wet conditions, damp conditions, or even after rain or a lot of wetter conditions are occurring. And because you are working with water all the time, there is the possibility that you're going to work in cold weather and wet weather as well. So it might not be raining, but because you're working with water, the area around you might also be cold. So what we are saying is wear the PPE that is supplied. Make sure that you have proper winter clothing, something that insulates you from the cold, but also lets perspiration evaporate. So you cannot just put on the clothing, you need to put on the right type of clothing. So what is the right type of clothing for you? Then you must please protect your feet and your toes. If you have to, wear 2 layers of socks. Cotton underneath, a pair of wool socks if it's possible. That is the best way to protect your feet. And then hand protection is also vital. Now, many of you have to wear specific types of gloves when working. Is it possible that you can wear another pair of mittens or warm gloves underneath those in order to work? Some say, well, it's not possible because we need our fingers to work with things. That's also fine. We understand it. I've been in situations that gloves actually make it more difficult to work. But then just limit the amount of work that you are doing without those gloves, and then put them on when you feel it is necessary. So there's nothing wrong with taking them off and then putting them back on again later. But looking after your body, seeing how often and how long you are exposed to these risks will then help you to design a proper procedure for the wearing of the correct type of PPE. Now, as we mentioned, we want to chat about immersion or trench foot. Now, with trench foot, you'll notice some visible changes to your feet. Now, what happens with trench foot is when it's immersed, as it says there, or if you are working in a trench. So this came about during World War II, where thousands of soldiers lost their lives because of trench foot. So they didn't understand what trench foot was or immersion foot was actually at that time. But because these soldiers were constantly walking in and out of trenches, which were always wet, especially during that time, World War II, we know where that took place, we can see that it was constantly damp and wet. And so the foot never, ever dried. And this caused serious health concerns. It led to blisters, blotchy skin, redness, skin tissue that dies and falls off. Then it also caused the following sensations in the actual foot. The feet kept getting cold. They felt heavy. They were numb. There was pain when exposed to heat, persistent itching, prickiness, and tingling. So what was the actual cause of this? Well, the cause of the trench foot was when it got wet and it did not dry off properly. Because they slept in these trenches, they didn't look after their feet or didn't understand what to do to look after their feet. It was then constantly bombarding their feet with this dangerous hazard. Now, for you as plumbers, we think to yourself, well, are you out in the trenches every day? No, perhaps not. We are not fighting a World War II, so we're not out there all the time. But is it possible for us to still get it? Well, definitely. If our feet are getting wet and we are not drying it off properly, and we're not talking about drying it off every week, we're talking about drying it off every single day. Every day we need to look after our feet. Now, it's most commonly caused during temperatures between 1 and 4 degrees Celsius. So we do have a couple of places here in SA that actually gets even lower than 1 degree Celsius. And so if your feet are in these conditions and they're getting wet, you have a very high risk of contracting what we call trench foot. Now, it can also occur in desert climates. Now, desert climates is hotter climates. So it's not necessarily just the temperature that is causing this type of disease. It is the key on how wet your feet is getting and not necessarily how cold they are. So as plumbers, you are at very high risk of this because you're working in constantly wet, damp conditions. Standing in wet socks and shoes for a long period of time tends to make it worse compared to other activities. So because you are standing and working in damp, wet conditions, what is the condition of your feet? Are you getting water into your safety boots? Are they getting wet? Even though your safety boots sometimes are water resistant, sometimes they are waterproof, is it still allowing some water to get into it? Now, remember, we are also saying that if you are standing in it for prolonged periods of time. Now, with prolonged cold and wetness, your feet can lose circulation and even nerve function, which means you will actually not feel whether they are wet, paining, because you've lost that circulation. You don't have nerve function anymore. And then you are deprived of the oxygen and nutrients that your blood normally provides. Sometimes the loss of nerve function can make other symptoms, as we mentioned, such as pain, less noticeable. So you might not realize that your feet are actually in pain until much later. The problem is you've already caused damage to your feet. And as we see in this picture, this is what's eventually happening to the skin. Now, this is because the entire surface of the skin is not getting enough oxygen and nutrients from the blood because the circulation is stopping, and that is now starting to affect the actual skin. If the skin stays like this for too long, the skin starts dying, and eventually the skin starts falling off. If we leave this type of condition untreated, so please, guys, if you find that your feet, even to a small degree, is starting to look dry, painful, a little less coloring like it should have, perhaps you're starting to find blisters or things like that on it. Remember, if you leave it untreated, you will end up with a serious condition later on. It might not happen now, but it will happen in the future. And we're not saying might happen, we are saying it will happen. Because if you do not treat your feet properly, over time, trench foot can lead to complications such as amputations. In other words, they cannot do anything to save that foot. They cannot do anything to save the skin or the toes around it. And so you might have to have it amputated. You could have severe blisters and inability to walk on the affected foot. Now imagine not being able to walk as a plumber. Well, that's going to make life very difficult. Gangrene or loss of tissue, permanent nerve damage or ulcers. You may also be more prone to complications if you have any wounds on your feet. If you're recovering from trench foot, you would be on the lookout for signs of infection, swelling, oozing of any wounds. So we know this is not a nice topic to talk about, but many of you are suffering with your feet currently, not understanding what it is potentially leading to. So let's take a look at the 4 stages of trench foot. Where are you in the stage? Has it happened to you already? Are you perhaps already in a stage of trench foot? Maybe you do not know this. Maybe you feel embarrassed to go to a doctor. Please do not feel that. It is your feet at the end of the day that are going to carry you everywhere. And if you do not look after them, there is a very high possibility that you could get this very dangerous condition, and it could just get worse to the point where your feet or toes or part of your foot needs to be amputated. So stage 1, this is also caused or called the injury stage. It is the stage in the restriction of blood flow and the tissue becomes numb and cold. There could also be discoloration of the affected limb with it turning white or red. Now, at this stage, the patient does not have to have any pain in this current stage. So the very first stage of trench foot just means that your feet and the tissue around the foot is starting to become numb and cold. It's starting to restrict the blood flow, and there is discoloration of the affected limb. So if you take your socks and shoes off and you see that the color of your feet is different from the color of the rest of your leg. Now, we are not talking about being tanned maybe in the sun. Perhaps you wear socks. I know for myself as a cyclist, when I come back, obviously my legs are more tan than my feet because my feet are not exposed to the sun. What we are talking about here is the actual condition of the skin coloring. So take a look at your skin, take a look at the dryness of the skin, take a look at the moisture, the elasticity of the skin, look under your foot, look in between your toes. examine your feet. You know what they look like. You should examine them all the time. Your feet are probably one of the most important parts of your body when it comes to musculoskeletal injuries. So at this stage, you might not be experiencing any pain, but you will find certain conditions that could become even more dangerous, especially if you do not stop them right away. So stage 2 is now the post-injury status. This occurs when the limb is warmed after exposure to severe cold and wet conditions. The color of the affected foot then becomes red from white. So instead of going back to a normal color, your feet starting to go red, but it will still be cold and numb. So now you think to yourself, if my foot goes red or discolored, so more color than white, that should necessarily in our minds say that we are getting blood back to that affected area, but it is not just blood. You see, blood will start flowing to a degree, but it's still cold and numb, which means we are not getting sufficient circulation, and we are now starting to get a fungus that is now starting to grow on that foot. And what also could happen is our feet could start to swell. Yes, feet will swell to a degree because of the way we walk, the shoes that we are working in. If we are working without socks, sometimes our feet can also swell. But this type of swelling, as you can see in the picture on the left-hand side, is a lot more severe. So if this starts happening, we are already at the point where trench foot has set in. And stage 3, this will last for about 3 months. At this stage, the affected foot now becomes warm and red, and then there is dryness of the skin. And you will experience numbness, tingling, and in some cases, you will start getting blisters. Then finally, the final stage, this is more or less a permanent stage in trench foot. Please understand the words that we are reading out here to you. This remains for the rest of the life of the individual. In other words, you will never, ever again not have this type of permanent stage of trench foot. The patient will have increased cold sensitivity, pins and needles, and some amount of pain in the affected foot. This remains for the rest of the life of the individual. It can either get worse until the point where you amputate the foot off to prevent it from spreading to the rest of the body. So guys, this is a serious condition, conditions that are affecting plumbers all the time, not just here in SA, but around the world. And not just plumbers, bricklayers, wet works, guys that are working in wet conditions and not looking after their feet. So how do you prevent this? What are you doing to prevent your feet from potentially getting so sick that they need to be cut off? Well, clean your feet, care for them, wear clean socks, and keep an extra pair with you if you are going to be working in wet conditions. Ensure your shoes are clean and dry. Now, if you can, we know that your employer must buy 1 pair of safety boots for you. Can you save up and buy yourself another set of safety boots? Can you ask your employer if you can contribute to another set of safety boots? Can you then alternate those safety boots from one day to the next, allowing them to stay at home for one entire day to get dry and stay clean, and then wear the other set the next day? This is going to go a long way in preventing foot disease as you see it happening over here. In fact, there's a lot more benefits to alternating your pair of shoes throughout the week. Things like muscle pain, tension, strain, even headaches can be caused by non-alternating of your shoes. Everything comes down to how we are looking after our feet. So please, it is vital. Don't wear dirty socks. Please do not work for prolonged periods in wet shoes. And then look after your feet. They will carry you everywhere for the rest of your life. And we do not want you losing your feet. So we hope after that, you will take the safety thought for this week very seriously. Stand up for safety. In fact, we can maybe say stand up for your safety. If you are having issues with your feet, speak to your employer. try and get to the doctor as soon as possible. Because it is an occupational injury, you will be able to then claim from COID to be able to go into the doctor and see if this cannot be rectified sooner, instead of getting to that stage 4 where it now becomes a permanent condition for the rest of your life. Looking at May 2022, we are looking at a few Toolbox Talk coming up. We're going to discuss COID. What is COID? How do you get your letter of good standing? And why must you stay up to date with COID? Then we're going to be looking at different types of welding that you plumbers are doing out there, and the risks and hazards, and also the prevention to serious incidents. We're going to then look at working at heights for the rest of the month. We're looking at ladders, scaffolding, and ceilings, and how can we prevent certain injuries and accidents from occurring during these times. So we want to say thank you very much for joining us this morning. Just to everybody, have a safe week, and please look after your bodies.